So we have had a meeting of the National Health Ministers, and that meeting resolved to commission nationally consistent guidelines in relation to diagnosis and prescription for ADHD. And I would like to know, first of all, who will be developing these rules.
Professor Anthony Lawler, Deputy Secretary, Health Products Regulation Group. Hello again, Senator. Thank you for the question. So, as the Secretary highlighted earlier this morning, this isn't a cross-portfolio matter, but it is a matter that engages a number of different groups within the Department of Health, Disability and Ageing. As previously discussed, when I was simultaneously in the role of Chief Medical Officer and also Deputy Secretary for Health Products Regulation, we took on the role of consulting with key stakeholders, including states, territories and peak bodies and medical colleges around the current landscape, which includes matters such as what is the prescribing process, what is the authority to become a prescriber in jurisdictions, what medicines are allowed to be dispensed and in what quantities, and also what cross-border arrangements are in place, which is particularly important for places like Tasmania and Northern Territory, but also, of course, when you're living in a border area. What we found was there a significant variance in practice across, but what we also found was that there was a real willingness in states and territories to, in many instances, liberalise the access, because, of course, this is an issue of balancing safety and quality versus the ability to access treatment. So it was a very useful conversation, and it gave us the ability to understand the landscape. We've incorporated that and, as you mentioned, advised the Health Ministers meeting on the matters that do relate, and what has come of that in terms of the communique that you've cited is that there was an acknowledgement of the reforms already announced by several jurisdictions and that there was an endorsed need for national harmonisation of ADHD diagnosis and prescribing practices, and that there had been work commissioned to develop nationally consistent rules with a progress report to be provided at the next HMM. Now, the challenge is, of course, that this is happening in at the same time as a number of other scope of practice pieces of work. So I do have at the table with me Eliza Strapp, who might be able to add to that.
Hi, Senator. Eliza Strapp, First Assistant Secretary, Health Workforce Division. So as Professor Lawler just outlined, we are undertaking a range of things around scope of practice for health professionals. And part of that, it came out of the scope of practice review that was undertaken by Mark Cormack last year. Part of that was a recommendation around harmonisation of drugs and poisons legislation. So as part of this, and as detailed in the communique on health ministers, we are working with our state and territory colleagues, and part of that work is, I think, fast-tracking the ADHD work to harmonise, to make consistent how we treat and diagnose and prescribe different ADHD and other things that can ensure that our health workforce is working to its full scope of practice.
Okay. So just to be clear, when it says there's been a work that has been commissioned,
yes,
who specifically has been commissioned to do that work?
It's a joint piece of work between all states and territories. The Commonwealth is, we're setting up a working group that's working with, because it doesn't just sit with, I guess, one area in jurisdictions. So we're setting up a working group that will be working across health departments. And the Commonwealth is leading that setup of that work, working in conjunction with the Health Workforce Task Force. That's a subgroup of the Health Chief Executives Forum.
Okay. And when will that working group be established?
I believe we're in the process of setting it up. I'm hopeful that it will be this month, Senator.
And when will they complete their work? When are they expected to complete their work?
It's I think we want to fast-track the ADHD work as an example. We've got to come back to health ministers with an update in October. I think a lot of work has already been undertaken. We've got some good examples from states and territories who are ahead of doing things. So what we want to do is build on what's already happened, and as Professor Lawler just talked about, a lot of work has happened across jurisdictions. I think we have to, obviously this does mean updating legislation. If you look at where each state and territory is up to at the moment, they're at varying levels. Some haven't legislated to change who can prescribe yet. I think we probably need to take stock of where things are up to, but we do have to report back in December. But I acknowledge we want to, fast-track the ADHD work ahead of other scope of practice or drugs and poisons work that we're doing.
Okay.
Sorry, that's not a clear answer for you.
If I may, Senator, and I think I've highlighted to you previously the challenges in the prescribing landscape across the country, that the TGA establishes the schedule for certain medicines, but it is state and territory poisons and medicines legislation that enact the ability to prescribe and the conditions and restrictions that apply to that, and that's particularly the case for S8 drugs.
Yes, of course. Okay, so we've got a working group that will be working to a timeline of December to deliver back to a subsequent meeting a proposed draft. Is it the intention of the working group?
I think it would work. And I'm saying this before the working group has actually met. I think the hope would be provide a framework of what the work would be that needs to happen in order to create national consistency around ADHD prescribing and treatment.
Okay. Thank you. So we don't have a time frame yet of when we would hope these nationally consistent rules will come into effect?
Not yet, Senator.
Okay. The communiqué said that there will be consultation on these new rules with relevant stakeholders. Will this include people with lived experience of ADHD themselves?
Without having the working group met, I would probably. I think consulting consumers on changes that affect them is a sensible idea. So, I would say that would likely happen. Yes.
Yes, consulting consumers is a really sensible idea. Can you table the terms of reference for the working group? Is that possible?
When we have developed them, yes.
Thank you. Multiple states have recently, as you acknowledged, made announcements in relation to this area, either bringing them into effect or flagging an intention to increase access to diagnosis and prescription via an expanded GP pathway. To clarify, is it the position of the Commonwealth to support increased access to ADHD diagnosis via diagnosis and prescription via your GP?
I can't reflect specifically on that policy question, but I'm not sure if it would be helpful, Senator. I can reflect on some of the changes and some of the consultations that came of that. But on the question of perhaps Ms Shakespeare?
Penny Shakespeare, Deputy Secretary, Health Resourcing. The Commonwealth supports reforms that will make sure that our health workforce is operating closer to the top of the scope of practice. We're consulting about whether or not specifically ADHD prescribing is currently supported for health practitioners, including GPs, to operate at the top of their scope of practice. I think the consultations that we've seen so far indicate that GPs could play a much greater role in access to medicines to treat ADHD.
Okay, thank you. What has that principle that there is a greater role to play for GP here been communicated by the Commonwealth to states and territories?
So in various forums we have discussed, this is a reform that we would like to pursue collaboratively with them, including groups such as the Health Workforce Task Force, yes.
Okay. Can you guarantee that the national rules that are being worked on now and hopefully will be brought into effect once developed won't go against the state and territory decisions and intentions that have been flagged already in relation to increasing access to diagnosis and to prescribing?
Senator, I don't think we're in a position to offer guarantees. We're working collaboratively with the states and territories with the objective of nationally harmonised approaches to make it, clear and consistent for patients, for providers, about how they can access treatment.
Okay. Minister, are you able today to give some assurance to the ADHD community in Australia that are very excited about the potential of greater role for GP in both diagnosis and prescription, that your government's going to be backing them in their call for a greater role for GP in this space?
Thanks for the question, Senator Steele-John. Minister Butler has worked very strongly in this area, especially since the committee report that came down in 2023. We responded in December 24, and now we see the discussions at the national level with the states and territories. So there is absolute commitment by our government, especially in this area, and I give that commitment to the families out there who are wanting to see a way through this.
Thank you. Now, we are in a period of almost constant shortage of medication when it comes to ADHD, with Ritalin and Concerta currently flagged as in shortage, and only recently the community having gone through a period where Vyvanse was listed nationally as a medicine in shortage. And I've heard many times from my constituents that in local areas it's still very hard to access your Vyvanse medications. I'm aware that the government has approved overseas substitutes and replacements, but this is a temporary solution to what to me seems to be becoming a more long-term problem. So my question is this: is the government taking action to ensure that there is a long-term supply of these critical medications?
So thanks for the question, Senator. Nick Henderson, First Assistant Secretary, Medicines Regulation Division. Yes, we acknowledge that there has been an ongoing shortage across methylphenidate medicines. That shortage has been ongoing, particularly in relation to the modified release medicines. The TGA, we have been working closely with the suppliers of those medicines, and as you acknowledged, Senator, we have put in place a number of 19A approvals under our legislation for alternative overseas products, and many of those products are now also subsidised under the PBS. We also have convened a regular medicine shortages action group, which cuts across health professionals, the suppliers, and other key stakeholders involved in the supply of those medicines, and we continue to work closely with those. We are also working closely with the pharmaceutical wholesalers to ensure there is fair and equitable supply through those supply chains. I might refer to my colleague Dr. Fenner as well to go into a bit more detail in relation to other actions we're taking.
Thank you. Dr. Tali Fenner, Acting Assistant Secretary, Pharmacovigilance Branch, Medicines Regulation Division. Yes, so just acknowledging that we have taken, as Mr Henderson said, a number of actions in terms of approving overseas alternatives, and they are listed on the PBS. So that's for the Ritalin and Concerta shortages, which are in modified release form. The immediate release forms are available. We also we convene meetings with our specific methylphenidate medicine shortage action group, and that includes medical colleges, health professional organisations, and through that we can work with those organisations to support them to develop some clinical advice. And we publish and communicate that on our website, and publish and communicate updates to the status of the shortages as they happen, because they do fluctuate. I note that you mentioned Vyvanse, difficulties with Vyvanse. The Vyvanse shortage has resolved at a national level, and we are working, continue where there are shortages to work with wholesalers to ensure equitable supply. So, that's, I guess, there's just some of the actions that we can take. I think it's important, though, to recognise that we can't compel sponsors to make applications, either for an ARTG registered product or for an overseas alternative.
Of course. Thank you, Dr. Fenner. In relation to the Medicine Shortage Action Group, just to confirm, that group has discussed the shortage of these medicines.
That's correct.
Yes.
So we convened a specific medicine shortage action group on the methylphenidate shortages, and the Vyvanse shortages have wound up.
When did that convening of that group to discuss that issue take place?
That was, I think, the last meeting was in May, I believe. I'll just confirm that that's correct.
Senator Steele-John, I do need to share the call, so I'm happy to come back to you in the next round. Sorry, I'll wait for the official to finish up and then we'll share the call. Thank you.
Sorry. I'll just take it on notice. I'll be able to confirm that.
We'll come back to this in my next
Yeah.
slot, so we can do that. Okay,
Thank you very much.
Thanks, Chair. Minister, through the national standardisation process for diagnosis and prescription, through the national standardisation process really for ADHD care, can you guarantee and assure people that no one will end up worse off? And that is, if you live right now in a state or a territory that is currently in the process of opening up pathways to ADHD care via your GP, which makes it much less costly, that as the result of the national standardisation process, nobody will have those access pathways shut off.
Thank you, Senator Steele-John. As I said previously, Minister Butler has been very committed to wanting to move on the recommendations in regards to the report that came through on ADHD, and he's done that through the recommendation 5, which was in coordinating with the states and territories in terms of the recent health ministers meeting in September. And so that I can say to families across Australia that there is a committed minister here, followed by his department, to work in that. It also includes, Senator Steele-John, the uniform reforms enabling GP diagnosis and prescription of ADHD medication, and it should be designed to ease pressure on individuals, on families and carers, without a doubt, and who currently navigate through a really costly and overloaded specialist system. So there is a real commitment by Minister Butler to do the work in terms of the recommendations that have come through.
Okay. Thank you. And does that... I just want to be really clear for people that you will ensure, and your government will ensure, that people won't go backwards in relation to access of ADHD care that they might be able to access in their state or territory.
Look, I would certainly say to all Australians that our government is focused on wanting to improve health and, cost of living in terms of health, with cheaper medicines, with what we've done with Medicare. And certainly the families that you're representing, Senator Steele-John, we are very aware, and the Minister's very aware, of the need to be able to move in this space. I cannot say any further what I've said to you already on the matter.
Okay. Now let's go back to the meetings of the Medicine Shortage Action Group. I'll give a moment for Dr. Fenner to get to the table.
Thank you. Yes, so I can confirm that the meeting of the Medicine Shortages Action Group was on the 13th of May, and since that time we've communicated with them regularly via email. We've done so providing updates, particularly when new 19A overseas alternatives become available or are PBS listed, and so we've communicated with them through May, June, July, and most recently in September.
Okay. And when is the next meeting of the action group?
I don't think we have one scheduled at the moment. We've been communicating, as I said, through email updates. And if there's a big shift in supply, that would prompt us to reconvene that group.
Okay.
Yeah.
Is the government looking at new ways to encourage onshore manufacturing of these medications so that we can have more long-term confidence in availability?
Senator, I think the Department of Industry has a range of programs to support local manufacturing of different products and has a focus on medical therapies, but we're probably not in a position to talk to you about those. We do have a range of approaches in the Health Department to try and manage shortages beyond the work that Dr Fenner has been discussing. So we've had a pharmaceutical wholesaler agreement reached in the end of last year, which included additional funding for wholesalers to make sure we're managing shortages of PBS medicines in a more coordinated way. So millions of dollars in funding under the community services obligation arrangements for wholesalers of medicines to support the Commonwealth in managing shortages, to proactively manage the supply of PBS-listed medicines into regional, rural and remote areas, and triaging orders of PBS medicines to make sure that we are supporting the National Medicines Policy. We also have the onshore stockpiling arrangements under PBS, which applies to certain medicines. We have, as discussed earlier, arrangements for the PBAC to urgently consider overseas brands listed by the TGA Section 19A listings. So we've got a range of approaches to manage shortages across the medicine supply chain.
Can I also highlight, sorry, Senator, and I might just ask Mr Henderson to comment on this as well, is we recognise that there's a perception that we are simply reactive to shortages. There is a challenge in that. We have a number of mechanisms for identifying shortages, but they're reactive. But I might ask Mr Henderson just to speak on the stakeholder forum that we've assembled and are using to approach that in a more systematic way.
Thanks, Professor Lawler. So, yes, so Senator, we have set up what we are calling the Medicine Shortages Stakeholder Forum, and that is represented by over 40 groups across healthcare, health professionals, consumer groups, industry. We held the first meeting on the 3rd of September 2025, and we are going to utilise that forum ongoing to test potential reform options, particularly in relation to reform options that the TGA can implement in relation to how we mitigate the impacts of medicine shortages, but also as a key area or forum where we can receive signals and information back through those key stakeholders in relation to their ideas and views, but also the impacts shortages are having on their representatives.
Thank you, Mr Henderson. If you could table for us the membership of that forum and the next meeting date for that forum, that would be much appreciated.
Certainly.
Thank you. Now, one of the challenges that I'm hearing about really clearly from the community is that overseas registered replacements under 19A are often inaccessible to many people, particularly that those that are not on the PBS currently, not PBS listed. Basically, that causes a significant financial barrier to being able to practically be able to afford the medication, even if it is technically available, and often you rock up to your pharmacy and they don't even have it in stock. So my question to you is this: are overseas registered replacements eligible for listing on the PBS?
Yes, Senator, and many medicines that go into shortages, we use PBS listings of 19A alternatives as an effective way of managing the way out of that shortage. So last year we had an example of entrocitabine and tenofovir, where we were able to make 19A listings. Recently, Bicillin has had a 19A listing, so that we've got greater access to that medicine in shortage. So many of them do get PBS listed.
And in relation to the shortage of ADHD medications, how many substances have we got under 19A at the moment that have been approved and are on that list as an overseas replacement?
We have several 19As with PBS listing, but supply can fluctuate a little bit. So it depends on, as I said, supply can fluctuate, and we keep them up to date on the website because of that fluctuating supply.
And I should clarify how many of them that are approved under 19A that are not PBS listed.
I don't have that in front of me, but I can come back with that.
Okay, if you could. And have any of the currently 19A listed replacements, have their sponsors made an application for PBS listing?
Senator, thank you. Duncan McIntyre, First Assistant Secretary, Technology Assessment and Access Division. My division handles the listing of items on the PBS. I would need to take on notice the current status of applications for listing on the PBS of these drugs, but we deal with these in an expedited manner and we encourage sponsors to bring them forward. We work actively with sponsors that suggest that they may be able to get supply of suitable substitute medications. It's fair to say that in some cases sponsors aren't able to procure a sufficient quantity that means that they're confident that they can provide that supply, but we work with them to try and manage that dynamically. We also work then with the pharmaceutical wholesalers that distribute these medications to pharmacies to seek to ensure that there is as equitable access as possible in cases where supply is limited.
A particular example that we can provide, Senator, is a 19A approved product of methylphenidate hydrochloride tablets. So a Switzerland brand was recommended at the May 2025 PBAC and has now been listed on the PBS. So we do have some 19A brands listed.
So just to be clear, that's the Section 19A replacement for Concerta it's sponsored by MedSurg Healthcare. Is that the substance you're referring to there?
A Switzerland version of Concerta.
Because my understanding was that was not PBS listed. I've had reports of people facing costs of up to $200 for 30 tablets. So you say
advice is that we've listed it on the PBS, yes.
Thank you. Could you...
yes, Senator, I can confirm that it has been listed on the PBS under 19A.
And when was it listed under?
It was listed on the 1st of July 2025 for provision on the PBS until the 31st of January 2026 at this stage.
Okay. Now, the TGA's website, the relevant medicine shortage website pages around these substances indicates the government expects the shortages of ADHD medications to last through till 2026. Mid-2026, I think, is the wording used. So are you telling me that the PBS listing will expire in January of 2026?
Senator, the way the 19A applications work is at the time the application is made, there's a sunset date, but there are provisions that allow those to be extended. And as we draw closer to that date, there will be an assessment as to whether there's a need for an ongoing Section 19A application, and we will work with the sponsor, and if they are willing to do so, then we will ensure that there are arrangements in place to allow that to be considered. There is, as I'm sure you're aware, Senator, ongoing tight supply for a range of reasons to do with these medications. There are issues associated with the country of origin and the APIs that underpin them and restrictions of these drugs which can be misused, of course, and that means that global supplies of these drugs are subject to regulations in other countries that mean it's challenging for the sponsors to bring them to Australia. But we continue to work on those supply chains to ensure that we can get as much of the globally available supply as possible.
Thank you. And this is my last question, and then we'll share the call. Could you provide on notice the list of currently 19A approved overseas replacements that are not PBS listed currently, and whether their sponsors have in fact made an application for listing on the PBS, and the status of that application if it has been made.
Yes, we can, Senator. And I might also add, Senator, we also strongly encourage when we go out for the 19A that they then pursue that PBS listing as well, so that's part of our processes.
Thank you. Thanks very much.
Thank you for your diligence, Senator Steele-John.
Authorised by J. Steele-John, Australian Greens, Canberra.